Welcome to the CCRN Mastery, the ultimate study guide for adult critical care nurses. Whether you're striving to elevate your nursing expertise, expand your career opportunities, or achieve your CCRN certification, you've come to the right place. This video is designed to guide you through the core concepts of critical care nursing, offering real-world scenarios, practical strategies, and key insights to help you excel. After each chapter, you'll find a dedicated Q&A session to reinforce your learning. For comprehensive preparation, check the description for access to the Audible version, the free Ultimate Exam Prep Guide, or the Amazon link for the book. Don't forget to like and subscribe for more updates and practice content. Now, let's begin this journey towards CCRN success with your instructor.
Number 1. What is the initial recovery sign of increased intracranial pressure, ICP? A. Bradycardia. B. Hypertension. C. Headache and vomiting. Or D. Dilated pupils on the affected side. The answer is C. Headache and vomiting. Number 2. Which medication is preferred for managing seizures in acute neurological injuries? A. Phenobarbital. B. Levetiracetam, Keppra. C. Diazepam. Or D. Carbamazepine. The answer is B. Levetiracetam, Keppra. Number 3. In assessing a patient with subarachnoid hemorrhage, what is the most common presenting symptom? A. Focal neurological deficits. B. Sudden severe headache. C. Loss of consciousness. Or D. Seizures. The answer is B. Sudden severe headache. Number 4. Which assessment tool is used to determine the level of consciousness in a patient with a neurological disorder? A. ABC score. B. Glasgow Coma Scale, GCS. C. Mini-Mental State Examination. Or D. Neurological Status Scale. The answer is B. Glasgow Coma Scale. Number 5. What is the primary goal of treatment in a patient with an ischemic stroke? A. To control seizures. B. To reduce cerebral edema. C. To restore blood flow. Or D. To prevent rebleeding. The answer is C. To restore blood flow. Number 6. Which type of stroke is treated with tissue plasminogen activator, TPA? A. Hemorrhagic stroke. B. Ischemic stroke. C. Transient ischemic attack. Or D. Subarachnoid hemorrhage. The answer is B. Ischemic stroke. Number 7. What is a common complication of a massive stroke affecting the brainstem? A. Chronic headache. B. Unilateral weakness. C. Locked-in syndrome. Or D. Aphasia. The answer is C. Locked-in syndrome. Number 8. Which intervention is most important for a patient post-cranial surgery to prevent increased ICP? A. Keeping the head of the bed elevated 30 degrees. B. Frequent neurological checks. C. Administration of corticosteroids. Or D. Inducing hypothermia. The answer is A. Keeping the head of the bed elevated 30 degrees. Number 9. What is the characteristic EEG finding in a patient with Creutzfeldt-Jakob disease, CJD? A. Absence of brain waves. B. Burst suppression pattern. C. Periodic sharp waves. Or D. Continuous slow waves. The answer is C. Periodic sharp waves. Number 10. Which neurological disorder is characterized by severe progressive muscle weakness and typically presents with ptosis and diplopia? A. Multiple sclerosis. B. Guillain-Barré syndrome. C. Myasthenia gravis. Or D. Amyotrophic lateral sclerosis, ALS. The answer is C. Myasthenia gravis. Number 11. Which neurological condition is characterized by a sudden transient episode of motor, sensory, or cognitive dysfunction caused by ischemia? A. Migraine. B. Epileptic seizure. C. Transient ischemic attack, TIA. Or D. Bell's palsy. The answer is C. Transient ischemic attack, TIA. Number 12. Which is a cardinal sign of Parkinson's disease? A. Muscle weakness. B. Tremor at rest. C. Hyperflexia. Or D. Sensory loss. The answer is B. Tremor at rest. Number 13. What is the most common cause of bacterial meningitis in adults? A. Streptococcus pneumonia. B. Neisseria meningitis. C. Haemophilus influenza. Or D. Listeria monocytogenes. The answer is A. Streptococcus pneumonia. Number 14. A patient with a spinal cord injury at T1 would most likely exhibit which of the following? A. Paraplegia. B. Quadriplegia. C. Hemiplegia. Or D. No significant motor loss. The answer is B. Quadriplegia. Number 15. What is the most effective initial treatment for a patient experiencing an acute ischemic stroke? A. High dose of aspirin. B. Intravenous thrombolytic therapy. C. Immediate craniotomy. Or D. Anticoagulant with heparin. The answer is B. Intravenous thrombolytic therapy. Number 16. What symptom is most indicative of a herniated intervertebral disc in the lumbar region? A. Cervical pain. B. Radiating leg pain. C. Bladder incontinence. Or C. Upper extremity weakness. The answer is B. Radiating leg pain. Number 17. Which is a common early sign of amyotrophic lateral sclerosis, ALS? A. Tremor. B. Memory loss. C. Muscle cramps and twitching. Or D. Visual disturbances. The answer is C. Muscle cramps and twitching. Number 18. Which medication is typically used first line for the prophylactic treatment of a migraine? A. Topiramate. B. Sumatriptan. C. Ibuprofen. Or D. Acetaminophen. The answer is A. Topiramate. Number 19. In Guillain-Barré syndrome, what is the typical sequence of muscle weakness? A. Starts in the upper body and moves downward. B. Starts in the lower body and moves upward. C. Is symmetric, starting distally and moving proximally. Or D. Is asymmetric and random. The answer is B. Starts in the lower body and moves upward. Number 20. What is the gold standard for diagnosing multiple sclerosis? A. Lumbar puncture. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT scan. Or D. Electromyography, EMG. The answer is B. Magnetic resonance imaging, MRI. Number 21. What is a key distinguishing feature of a seizure stemming from epilepsy versus other causes? A. Occurrence during sleep. B. Preceded by an aura. C. Recurrent seizures. Or D. Triggered by fever. The answer is C. Recurrent seizures. Number 22. Which condition is characterized by extreme swings in mood, energy, and functioning? A. Schizophrenia. B. Bipolar disorder. C. Major depression. Or D. Anxiety disorder. The answer is B. Bipolar disorder. Number 23. Which complication is commonly associated with a hemorrhagic stroke? A. Aneurysm. B. Vasospasm. C. Seizures. Or D. All of the above. The answer is D. All of the above. Number 24. What is the most common type of primary brain tumor? A. Meningioma. B. glioblastoma, C. pituitary adenoma, or D. acoustic neuroma? The answer is B. glioblastoma. Number 25. What is the primary treatment for status epilepticus? A. Immediate intubation. B. Rapid sequence induction and intubation. C. Intravenous benzodiazepines. Or D. Oral epileptic drugs. The answer is C. Intravenous benzodiazepines. Number 26. For patients with severe traumatic brain injury, TBI, what is a critical step in preventing secondary injury? A. Maintaining cerebral perfusion pressure. B. Ensuring tight glycemic control. C. Early administration of antibiotics. Or D. Inducing mild hypothermia. The answer is A. Maintaining cerebral perfusion pressure. Number 27. Which type of headache is characterized by severe unilateral pain, often around the eye, and can have autonomic symptoms like tearing and rhinorrhea? A. Tension-type headache. B. Cluster headache. C. Migraine. Or D. Sinus headache. The answer is B. Cluster headache. Number 28. What is a common risk factor for transient ischemic attacks, TIAs, and strokes? A. High cholesterol. B. Smoking. C. Hypertension. Or D. All of the above. The answer is D. All of the above. Number 29. Which is a late sign of increased intracranial pressure, ICP? A. Headache. B. Vomiting. C. Bradycardia with hypertension, Cushing's triad. Or D. Confusion. The answer is C. Bradycardia with hypertension, Cushing's triad. Number 30. Which is the primary mechanism of injury in secondary brain injury? A. Direct trauma to the brain tissue. B. Lack of oxygen and nutrients to the brain tissue. C. Inflammatory response in the brain. Or D. All of the above. The answer is B. Lack of oxygen and nutrients to brain tissue. Number 31. Which imaging modality is most sensitive for detecting acute ischemic shock within the first few hours of symptoms onset? A. Computed tomography, CT scan. B. Magnetic resonance imaging, MRI. C. Positron emission tomography, PET. Or D. Single photon emission computed tomography, SPECT. The answer is B. Magnetic resonance imaging, MRI. Number 32. What is the most common early symptom of a brain tumor? A. Seizures. B. Headache. C. Nausea. Or D. Cognitive changes. The answer is B. Headache. Number 33. Which term describes involuntary rhythmic movement of the eyes? A. Anisocoria. B. Nystagmus. C. Diplopia. Or D. Ptosis. The answer is B. Nystagmus. Number 34. What is the definitive treatment for hydrocephalus? A. Ventricular peritoneal shunt. B. Craniotomy. C. High-dose corticosteroids. Or D. Therapeutic lumbar puncture. The answer is A. Ventriculoperitoneal shunt. Number 35. Which condition is an autoimmune disorder characterized by weakness that increases during periods of activity and improves after periods of rest? A. Guillain-Barré syndrome. B. Multiple sclerosis. C. Myasthenia gravis. Or D. Amyotrophic lateral sclerosis. The answer is C. Myasthenia gravis. Number 36. What is a typical feature of the pain experienced with trigeminal neuralgia? A. Dull and continuous. B. Sharp and stabbing. C. Throbbing and persistent. Or D. Deep and aching. The answer is B. Sharp and stabbing. Number 37. Which of the following is a potential complication of lumbar puncture? A. Cerebral herniation. B. Spinal cord injury. C. Postdural puncture headache. And D. Epidural hematoma. The answer is C. Postdural puncture headache. Number 38. What is the most common presenting symptoms of a pituitary adenoma? A. Visual changes. B. Headache. C. Hormonal imbalance. Or D. Nausea. The answer is A. Visual changes. Number 39. Which substance is typically elevated in the cerebrospinal fluid, CSF, of patients with bacterial meningitis? A. Glucose. B. Red blood cells. C. White blood cells. Or D. Protein. The answer is C. White blood cells. Number 40. What is the term for a stroke that occurs when a blood vessel in the brain leaks or ruptures? A. Ischemic stroke. B. Transient ischemic attack. C. Hemorrhagic stroke. Or D. Cerebral infarction. The answer is C. Hemorrhagic stroke. Number 41. What is the first-line treatment for acute migraine with aura? A. Ergotamine. B. Acetaminophen. C. Sumatriptan. Or D. Caffeine. The answer is C. Sumatriptan. Number 42. Which neurological disorder is associated with plaques and tangles in the brain tissue? A. Parkinson's disease. B. Alzheimer's disease. C. Huntington's disease. Or D. Creutzfeldt-Jakob disease. The answer is B. Alzheimer's disease. Number 43. What is the primary symptom of narcolepsy? A. Insomnia. B. Excessive daytime sleepiness. C. Sleep paralysis. Or D. Night terrors. The answer is B. Excessive daytime sleepiness. Number 44. Which of the following is a risk factor in developing cerebral palsy? A. Maternal infection. B. Genetic predisposition. C. Birth asphyxia. Or D. All of the above. The answer is D. All of the above. Number 45. What is the most common cause of spinal cord injury? A. Falls. B. Motor vehicle accidents. C. Sports injuries. Or D. Assaults. The answer is B. Motor vehicle accidents. Number 46. Which of the following is a hallmark sign of meningitis? A. Brodzinski's sign. B. Koenig's sign. C. Both A and B. Or D. None of the above. The answer is C. Both A and B. Number 47. Which therapy is considered first line for treating relapsing remitting multiple sclerosis? A. Corticosteroids. B. Plasmapheresis. C. Beta interferons. Or D. Immunoglobulins. The answer is C. Beta interferons. Number 48. What is the mainstay of treatment for bacterial meningitis? A. Antiviral medications. B. Antibiotics. C. Steroids. D. Supportive care only. The answer is B. Antibiotics. Number 49. What is the predominant symptom of a lower motor neuron lesion? A. Spasticity. C. Flaccidity. C. Hyperreflexia. Or D. Positive Babinski sign. The answer is B. Flaccidity. Number 50. Which term describes a brief loss of consciousness caused by a temporary decrease in brain blood flow? A. Seizure. B. Stroke. C. Syncope. D. Coma. The answer is C. Syncope. Number 51. What is the most common type of seizure experienced by patients with epilepsy? A. Generalized tonic-clonic. B. Absence. C. Simple partial. Or D. Complex partial. The answer is A. Generalized tonic-clonic. Number 52. Which of the following conditions is a surgical emergency, often resulting from an untreated or inadequately treated epidural hematoma? A. Hydrocephalus. B. Subdural hematoma. C. Cerebral herniation. Or D. Intracerebral hemorrhage. The answer is C. Cerebral herniation. Number 53. In managing a patient with traumatic brain injury, what is the target range for PaCO2 to avoid cerebral vasoconstriction or vasodilation? A. 25 to 30 millimeters mercury. B. 35 to 45 millimeters mercury. C. 50 to 60 millimeters mercury. Or D. None of the above. The answer is B. 35 to 45 millimeters mercury. Number 54. Which vitamin deficiency is most commonly associated with Wernicke encephalopathy? A. Vitamin B1, thiamine. B. Vitamin B12. C. Vitamin C. Or D. Vitamin D. The answer is A. Vitamin B1, thiamine. Number 55. Which disorder is characterized by the rapid onset of muscle rigidity, high fever, and autonomic instability, often in response to a neuroepileptic medication? A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Malignant hyperthermia. Or D. Delirium. The answer is B. Neuroleptic malignant syndrome. Number 56. What is considered the most definitive symptom of a subarachnoid hemorrhage? A. Loss of consciousness. B. Thunderclap headache. C. Seizure. D. Nausea and vomiting. The answer is B. Thunderclap headache. Number 57. Which is an essential feature of delirium? A. Chronic progression. B. Disturbed consciousness. C. Focal neurological deficits. Or D. Permanent cognitive decline. The answer is B. Disturbed consciousness. Number 58. What is the main pathological process in Alzheimer's disease? A. Neurofibrillary tangles and amyloid plaques. B. Autoimmune destruction of the myelin sheath. C. Lewy body accumulation. Or D. Progressive loss of dopamine neurons. The answer is A. Neurofibrillary tangles and amyloid plaques. Number 59. Which condition is typically characterized by high fever, altered mental status, and rigidity following administration of antipsychotic drugs? A. Serotonin syndrome. B. Neuroepileptic malignant syndrome. C. Malignant hyperthermia. Or D. Delirium tremens. The answer is B. Neuroepileptic malignant syndrome. Number 60. Which is the most appropriate first step in the management of a patient suspected to have bacterial meningitis? A. Initiate antiviral therapy. B. Administer broad-spectrum antibiotics. C. Perform a CT scan. D. Start antifungal treatment. The answer is B. Administer broad-spectrum antibiotics. Number 61. Which of the following is a common early sign of increased intracranial pressure, ICP? A. Hypertension. B. Bradycardia. C. Changes in levels of consciousness. Or B. Pupillary asymmetry. The answer is C. Change in level of consciousness. Number 62. What is the treatment of choice for a patient diagnosed with trigeminal neuralgia? A. Carbamazepine. B. Gabapentin. C. Opioid analgesics. Or D. Corticosteroids. The answer is A. Carbamazepine. Number 63. Which is a common clinical feature of a patient with Huntington's disease? A. Rigidity. B. Choreiform movements. C. Tremor at rest. And D. Bradykinesia. The answer is B. Choreiform movements. Number 64. Which of the following is a cardinal feature of normal pressure hydrocephalus? A. Urinary incontinence. B. Dementia. C. Gait disturbance. D. All of the above. The answer is D. All of the above. Number 65. What is the primary risk factor for stroke? A. Diabetes mellitus. B. Hypertension. C. Smoking. Or D. High cholesterol. The answer is B. Hypertension. Number 66. What is the first-line medication for acute treatment of status epilepticus? A. Phenobarbital. B. Lorazepam. C. Levetiracetam. Or D. Phenytoin. The answer is B. Lorazepam. Number 67. Which type of headache is most likely to present with a band-like pain around the head? A. Migraine. B. Cluster. C. Tension type. Or D. Sinus. The answer is C. Tension type. Number 68. What is the hallmark clinical feature of Parkinson's disease? A. Tremor. B. Cognitive decline. C. Muscle weakness. Or D. Bradykinesia. The answer is D. Bradykinesia. Number 69. In a patient with acute ischemic stroke, which imaging study is typically performed first? A. MRI. B. CT scan. C. PET scan. Or D. SPECT. The answer is B. CT scan. Number 70. What is the primary pathological change in the brain of a patient with Parkinson's disease? A. Amyloid plaques. B. Loss of dopamine-producing cells in the substantia nigra. C. White matter hyperintensities. Or D. Neurofibrillary tangles. The answer is B. Loss of dopamine-producing cells in the substantia nigra. Number 71. Which of the following is a classic sign of a basilar skull fracture? A. Periorbital ecchymosis, raccoon eyes. B. Hemiparesis. C. Vomiting. Or D. Tinnitus. The answer is A. Periorbital ecchymosis, raccoon eyes. Number 72. Which condition is known for causing saddle anesthesia, affecting the buttocks, perineum, and inner thighs? A. Lumbar disc herniation. B. Cauda equina syndrome. C. Spinal stenosis. D. Peripheral neuropathy. The answer is B. Cauda equina syndrome. Number 73. What is the initial treatment for a patient experiencing a tonic-clonic seizure? A. Intravenous benzodiazepines. B. Oral antiepileptic drugs. C. Immediate intubation. D. Physical restraints. The answer is A. Intravenous benzodiazepines. Number 74. Which of the following is not a typical feature of Bell's palsy? A. Rapid onset of facial paralysis. B. Forehead wrinkles preserved. C. Drooping of one side of the face. Or D. Decreased tearing. The answer is B. Forehead wrinkles preserved. Number 75. What percentage of strokes are classified as ischemic? A. About 20%. B. About 50%. C. About 70%. D. About 85%. The answer is D. About 85%. Number 76. What is the most common precipitating factor for a sickle cell crisis in a patient with sickle cell disease? A. High altitude. B. Dehydration. C. Infection. Or D. Cold weather. The answer is C. Infection. Number 77. Which component is essential to include in a secondary assessment for a patient with a suspected traumatic brain injury, TBI? A. Glasgow Coma Scale score. B. Blood glucose level. C. Past medical history. Or D. All of the above. The answer is D. All of the above. Number 78. Which is an early symptom of amyotrophic lateral sclerosis, ALS? A. Inability to speak. B. Difficulty swallowing. C. Muscle twitches and cramps. Or D. Complete paralysis. The answer is C. Muscle twitches and cramps. Number 79. Which medication is not typically used in the management of acute migraine headache? A. Acetaminophen. B. Sumatriptan. C. Diazepam. Or D. Metoclopramide. The answer is C. Diazepam. Number 80. What is the term for a prolonged seizure lasting more than 5 minutes or consecutive seizures without full recovery between them? A. Epilepticus. B. Status epilepticus. C. Grand mal seizure. Or D. Petit mal seizure. The answer is B. Status epilepticus. Number 81. What is the primary goal in the management of Guillain-Barré syndrome? A. Rapid reversing paralysis. B. Preventing respiratory failure. C. Long-term immunosuppression. Or D. Pain management. The answer is B. Preventing respiratory failure. Number 82. Which is a typical early sign of increasing intracranial pressure in adults? A. Bulging fontanelle. B. Bradycardia. C. Hemiparesis. Or D. Photophobia. The answer is A. Bulging fontanelle. Number 83. What is the most common cause of a transient ischemic attack, TIA? A. Hemorrhage. B. Embolism. C. Arterial hypertension. Or D. Aneurysm. The answer is B. Embolism. Number 84. Which of the following is a common early symptom of Parkinson's disease? A. Tremor. B. Cognitive decline. C. Muscle rigidity. Or D. Loss of smell. The answer is A. Tremor. Number 85. What is the preferred initial imaging technique for a suspected acute hemorrhagic stroke? A. MRI. B. CT scan. C. PET scan. Or D. X-ray. The answer is B. CT scan. Number 86. Which is an important nursing intervention for a patient with myasthenia gravis? A. Frequent repositioning. B. Assisting with ambulation. C. Monitoring respiratory function. Or D. Providing a low-carbohydrate diet. The answer is C. Monitoring respiratory function. Number 87. Which vitamin deficiency is commonly associated with peripheral neuropathy? A. Vitamin B1. B. Vitamin B12. C. Vitamin C. Or D. Vitamin E. The answer is B. Vitamin B12. Number 88. Which is a major risk factor for the development of delirium in hospitalized patients? A. High blood pressure. B. Age over 65. C. Previous psychiatric history. Or D. Female gender. The answer is B. Age over 65. Number 89. What is the most effective treatment for a patient with acute bacterial meningitis? A. Immediate corticosteroids. B. High-dose antibiotics. C. Supportive care only. Or D. Antiviral medications. The answer is B. High-dose antibiotics. Number 90. What is the main treatment strategy for a patient with a spinal cord injury? A. Immediate surgery. B. High-dose steroids. C. Rehabilitation and physical therapy. Or D. Hyperbaric oxygen therapy. The answer is C. Rehabilitation and physical therapy. Number 91. Which clinical feature is a characteristic of a cluster headache? A. Bilateral pain. B. Occurs in series or clusters. C. Associated with aura. D. Relieved by lying down. The answer is B. Occurs in series or clusters. Number 92. What is the most common early symptom of multiple sclerosis? A. Tremor. B. Fatigue. C. Visual disturbances. Or D. Cognitive impairment. The answer is C. Visual disturbances. Number 93. Which of the following is an appropriate intervention for managing increased intracranial pressure? ICP. A. Fluid restriction. B. Trendelenburg positioning. C. Administration of mannitol. Or D. High-dose barbiturates. The answer is C. Administration of mannitol. 94. Which of the following is not a feature of autonomic dysreflexia? A. Hypertension. B. Bradycardia. C. Warm, flushed skin above the level of injury. D. Cold, clammy skin below the level of injury. The answer is D. Cold, clammy skin below the level of injury. Number 95. Which condition is characterized by involuntary, quick, jerky movements? A. Ataxia. B. Dyskinesia. C. Chorea. Or D. Dystonia. The answer is C. Chorea. 96. What is the first-line treatment for a patient presenting with acute central nervous system, CNS, vasculitis? A. Plasmapheresis. B. High-dose corticosteroids. C. Intravenous immunoglobulin, IVIG. Or D. Cyclophosphamide. The answer is B. High-dose corticosteroids. 97. What is the typical presentation of a herniated cervical disc? A. Lower back pain. B. Neck pain and radiculopathy. C. Bladder incontinence. Or D. Lower extremity weakness. The answer is B. Neck pain and radiculopathy. Number 98. What is the gold standard diagnostic test for epilepsy? A. Brain MRI. B. CT scan. C. Electroencephalogram. D. Lumbar puncture. The answer is C. Electroencephalogram. Number 99. Which is the most common cause of spontaneous subarachnoid hemorrhage? A. Trauma. B. Aneurysm rupture. C. Hypertension. D. Coagulopathy. The answer is B. Aneurysm rupture. Number 100. Which of the following is a symptom of post-polio syndrome? A. High fever. B. New muscle weakness. C. Sensory loss. D. Uncontrolled movements. The answer is B. New muscle weakness. 101. What is the primary treatment for carpal tunnel syndrome? A. NSAID and rest. B. Corticosteroid injection. C. Surgical decompression. Or D. All of the above. The answer is D. All of the above. Number 102. Which condition is often associated with a cherry red spot on fundoscopy? A. Diabetic retinopathy. B. Tay-Sachs disease. C. Macular degeneration. Or D. Glaucoma. The answer is B. Tay-Sachs disease. Number 103. What is the most significant risk factor for the development of a cerebral aneurysm? A. Smoking. B. Hypertension. C. High cholesterol. D. Diabetes. The answer is B. Hypertension. 104. Which neurological condition is characterized by severe headache, fever, and a stiff neck? A. Encephalitis. B. Migraine. C. Meningitis. D. Intracerebral hemorrhage. The answer is C. Meningitis. Number 105. What is the leading cause of secondary brain injury following trauma? A. Hemorrhage. B. Hypoxia. C. Infection. Or D. Edema. The answer is B. Hypoxia. Number 106. What is the primary goal of treatment in a patient with a spinal cord injury? A. Pain relief. B. Prevention of a secondary injury. C. Immediate restoration of mobility. D. Surgical repair of the injury. The answer is B. Prevention of secondary injury. Number 107. What is the hallmark clinical feature of a patient with a frontal lobe brain tumor? A. Loss of vision. B. Personality changes. C. Seizures. D. Memory loss. The answer is B. Personality changes. Number 108. Which of the following is not a common side effect of anti-epileptic drugs, AEDs? A. Dizziness. B. Weight loss. C. Fatigue. D. Rash. The answer is B. Weight loss. Number 109. What is the most common cause of dementia in the elderly? A. Alzheimer's disease. B. Vascular dementia. C. Frontotemporal dementia. C. Dementia with Lewy bodies. The answer is A. Alzheimer's disease. Number 110. Which of the following is a recommended intervention for a patient with advanced Parkinson's disease experiencing dysphagia? A. Provide thin liquids. B. Encourage rapid eating. C. Speech therapy evaluation. Or D. High-calorie supplements. The answer is C. Speech therapy evaluation. Number 111. Which type of headache is characterized by intense unilateral pain, often accompanied by nausea and sensitivity to light and sound? A. Tension-type headache. B. Cluster headache. C. Migraine. D. Sinus headache. The answer is C. Migraine. Number 112. What is the most common initial symptom of a brain abscess? A. Fever. B. Seizures. C. Focal neurological deficits. D. Headache. The answer is D. Headache. 113. What is the standard treatment for acute bacterial meningitis in adults? A. Intravenous antiviral therapy. B. Intravenous antibiotics. C. Steroid therapy. D. Supportive care only. The answer is B. Intravenous antibiotics. Number 114. Which neurological disorder is characterized by a rapid deterioration over days to weeks, often triggered by infection or immunization? A. Guillain-Barré syndrome. B. Multiple sclerosis. C. Amyotrophic lateral sclerosis. D. Myasthenia gravis. The answer is A. Guillain-Barré syndrome. Number 115. What is the first sign of a herniated lumbar disc? A. Cauda equina syndrome. B. Lower back pain. C. Saddle anesthesia. D. Sciatica. The answer is B. Lower back pain. Number 116. What is the most effective initial treatment for status migrainosus? A. Rest in a dark, quiet room. B. Intravenous fluids. C. Intravenous corticosteroids. D. Intravenous dihydroergotamine. The answer is D. Intravenous dihydroergotamine. 117. Which is a common side effect of long-term use of levodopa in the treatment of Parkinson's disease? A. Hypotension. B. Motor fluctuations. C. Hepatotoxicity. D. Renal failure. The answer is B. Motor fluctuations. 118. What is the main cause of secondary brain injury? A. Initial traumatic impact. B. Hemorrhage. C. Ischemia and cellular death. D. Infection. The answer is C. Ischemia and cellular death. Number 119. What is a characteristic feature of Lewy body dementia? A. Rapid onset of symptoms. B. Visual hallucinations. C. Absence of cognitive decline. D. Continuous movement difficulties. The answer is B. visual hallucinations. 120. Which of the following is considered a reversible cause of dementia? A. Alzheimer's disease. B. Normal pressure hydrocephalus. C. Lewy body dementia. D. Vascular dementia. The answer is B. Normal pressure hydrocephalus. 121. What is the gold standard for treatment of trigeminal neuralgia? A. Anticonvulsant medication. B. Microvascular decompression surgery. C. Radiofrequency thermal lesioning. D. Steroid therapy. The answer is B. Microvascular decompression surgery. 122. Which of the following is a typical sign of advanced Alzheimer's disease? A. Restlessness at night. D. Difficulty swallowing. C. Increased language skills. D. Improved short-term memory. The answer is B. Difficulty swallowing. 123. What is the most common cause of stroke in young adults? A. Hypertension. B. Cardiac embolism. C. Atherosclerosis. D. Hemorrhage. The answer is B. Cardiac embolism. Number 124. Which of the following is not a common treatment for spasticity in patients with neurological conditions? A. Baclofen. B. Botulinum toxin injections. C. NSAIDs. D. Physical therapy. The answer is C. NSAIDs. 125. What is the primary mechanism of injury in traumatic brain injury, TBI? A. Infection. B. Ischemia. C. Direct impact. D. Autoimmune reaction. The answer is C. Direct impact. Number 126. What is the most common presenting symptom of a pituitary adenoma? A. Headache. B. Vision changes. C. Weight gain. D. Hormonal imbalances. The answer is B. Vision changes. 127. What is the most common form of dementia? A. Alzheimer's disease. B. Vascular dementia. C. Lewy body dementia. Or D. Frontotemporal dementia. The answer is A. Alzheimer's disease. Number 128. Which of the following is not a feature of myasthenia crisis? A. Severe muscle weakness. B. Increased respiratory secretions. C. High fever. D. Difficulty breathing. The answer is C. High fever. Number 129. Which imaging technique is most commonly used to diagnose multiple sclerosis? A. CT scan. B. MRI. C. PET scan. D. Ultrasound. The answer is B. MRI. Number 130. What is the most effective intervention for preventing stroke in patients with atrial fibrillation? A. Antiplatelet therapy. B. Anticoagulant therapy. C. Beta blockers. D. Cholesterol-lowering medications. The answer is B. Anticoagulant therapy. 131. What is the primary symptom of a patient experiencing a migraine with aura? A. Visual disturbances before the headache. B. Nausea and vomiting during the headache. C. Severe unilateral throbbing pain. D. Photophobia and phonophobia. The answer is A. Visual disturbances before the headache. 132. Which assessment is most crucial for patients with a suspected stroke? A. Time of onset of symptoms. B. Blood pressure measurement. C. Temperature. D. Blood glucose levels. The answer is A. Time of onset of symptoms. 133. What is the typical treatment for a patient with a diagnosed arteriovenous malformation, AVM? A. Conservative management with observation. B. Surgical resection. C. Endovascular embolization, D. All of the above. The answer is D. All of the above. Number 134. What condition is characterized by extreme weakness and fatigue that worsens after exertion and improves with rest? A. Chronic fatigue syndrome, B. Myasthenia gravis, C. Guillain-Barré syndrome, or D. Amyotrophic lateral sclerosis. The answer is B. Myasthenia gravis. 135. Which of the following is a common early sign of a brain tumor? A. Hemiparesis, B. Aphasia, C. Seizures, D. Headache. The answer is D. Headache. Number 136. What is the primary treatment for a patient experiencing an acute ischemic stroke? A. Intravenous thrombolysis, B. High-dose aspirin, C. Surgical decompression, or D. Hypothermia therapy. The answer is A. Intravenous thrombolysis. 137. What is the most common presenting symptom of a spinal cord tumor? A. Incontinence, B. Back pain, C. Gait disturbance, D. Muscular atrophy. The answer is B. Back pain. 138. Which medication is commonly used to prevent migraine headaches? A. Ibuprofen, B. Acetaminophen, C. Propranolol, D. Sumatriptan. The answer is C. Propranolol. Number 139. What is a potential complication of untreated severe hypertension in a patient with a history of stroke? A. Rebleeding, B. Seizure, C. Hypertensive encephalopathy, D. Migraine. The answer is C. Hypertensive encephalopathy. Number 140. What is the term for difficulty speaking or understanding speech as a result of a stroke? A. Dysarthria, B. Aphasia, C. Ataxia, D. Anomia. The answer is B. Aphasia. 141. What is the most effective treatment for a patient with a herniated disc and sciatica? A. Bed rest for several weeks, B. Epidural steroid injections, C. Physical therapy, D. Surgical intervention. The answer is B. Surgical intervention. 142. What is the main goal in the treatment of a patient with epilepsy? A. Complete cure of the disease, B. Complete elimination of seizures, C. Reduction of seizure frequency and severity, D. Identification and removal of the brain lesion. The answer is C. Reduction of seizure frequency and severity. 143. What is the most common type of involuntary movement associated with Huntington's disease? A. Tremor, B. Dystonia, C. Chorea, D. Myoclonus. The answer is C. Chorea. 144. What is the most important factor in determining the prognosis of a patient with traumatic brain injury? A. Age of the patient, B. Glasgow Coma Scale score at the time of injury, B. Length of time unconscious, D. Presence of a skull fracture. The answer is B. Glasgow Coma Scale score at the time of injury. 145. Which is not a common feature of autonomic dysreflexia? A. Hypertension, B. Bradycardia, C. Hot, dry skin, D. Headache. The answer is C. Hot, dry skin. 146. What is the primary goal of rehabilitation for patients with paraplegia? A. Restoration of limb function, B. Prevention of secondary complications, C. Pain management, D. Cure of the underlying condition. The answer is B. prevention of secondary complications. 147. Which condition is characterized by painful muscle contractions in the neck and shoulders, often with a postural abnormality? A. Dystonia. B. Spasmodic torticollis. C. Myasthenia gravis. D. Tetanus. The answer is B. Spasmodic torticollis. 148. What is the primary diagnostic criterion for Parkinson's disease? A. Presence of Lewy bodies in the brain. B. Clinical manifestation of 2 out of 3 cardinal symptoms: resting tremor, rigidity, bradykinesia. C. Positive response to dopamine medication. D. MRI findings. The answer is B. Clinical manifestation of 2 out of 3 cardinal symptoms: resting tremor, rigidity, bradykinesia. 149. Which of the following is a common early symptom of frontotemporal dementia? A. Memory loss. B. Spatial disorientation. C. Personality changes. D. Language difficulties. The answer is C. Personality changes. 150. What is the primary treatment for a patient with neurogenic shock following a spinal cord injury? A. Immobilization of the spine. B. Administration of vasopressors. C. High-dose corticosteroids. D. Rapid rehydration. The answer is B. Administration of vasopressors.